Son. You good. Don't mess with it.
Okay. 993-875.
So you do know we have two guests that's doing two separate things. One is Equal Hope, and the other one is from the National Kidney Society.
I send the link to people.
So you would enter the studio, try to get in before we live.
Okay.
You gotta use your Safari.
Okay.
Oh Lord, you gotta re-sign in.
You shouldn't have to need another code though.
I hope not.
Yeah.
What's up, Facebook?
You have a minute and a half.
Good.
Yep, send another code.
You need a new code?
Yeah, it's another code. Yeah, because I'm on Safari now. Yeah, I don't like Safari. It has to be in Safari.
It is.
Hi, Paris. This is Rolanda Sanders giving you another call. Just following up to see if
162-645.
9444-9406.
Okay. Studio. And it says allow. Do I click allow?
Yep. Allow. Now stop cam. Put your name.
My name.
Yep. Now look. Always mute your mic. Remove yourself from the stream.
20 seconds.
That's it. And then for the guests, yep, cut your volume all the way down. Then you send them the link.
Okay.
We'll send it to Rolanda so she can set her people up.
I got that.
So you don't get beat up.
You have it on?
Thank you. But yeah.
You're rocking with the Brunch Bunch right here on Inspiration 1390. It is Tell Me Something Good Tuesday, and I want to tell you something good. If you hear the sound of my voice, that means you are alive and well. And you know what? If you're not feeling that well, all you have to do is speak those things as though they were and say that I am well. Rolanda said that is not how I'm saying it how I want to say it, Rolanda. It's your baby, Action Jackson, and you're rocking with the Brunch Bunch right here on Inspiration 1390. You know, it is Community Chatter Tuesday with Win-Win Communications. That's none other than Winona Redmond, and she always brings us new best friends to meet. And today, we have two spectacular guests going to be joining us for Community Chatter. So you know what? We got some updates on some hot topics. You know, the world is on fire, literally and figuratively. But you know what? We're going to talk about it when we get back. Don't go nowhere. We got way more to share right here on Inspiration 1390.
It is.
What I say?
I don't know what you said. Let me
Send that intro.
I had just sent it to myself.
I had to close the app because when you turn down the volume all the way, I can hear you echoing.
Okay.
It's Latricia May, your executive loan officer.
And Shirley Fields, your real estate guru.
Let's rap. Building wealth via real estate. Sponsored by LNS Development.
That's the best one because that was the best one out of all of them.
No, we may have to redo that. No, I ain't like it. This sounded a little cheesy.
Well, see, look, that was the best one.
It's Latricia May, your executive loan officer.
And Shirley Fields, your real estate guru.
Let's rap. Building wealth via real estate. Sponsored by LNS Development.
They don't sound that bad.
They don't sound too.
Like without the music, it don't sound good. But like the music,
it sounds like a bad infomercial.
I mean,
text that to me so I can send it to him. I feel like the front of my hair is just sticking up. And push that down, so right there. Speak those things as though they were.
Speak those things which are not as though they were.
Hey, I like my way better. But we gonna go to Laura's way.
This Latricia May, your executive loan officer. At Shirley Fields, your real estate guru. Let's
Right.
building Web Real Estate, sponsored by LNS Development.
Okay, got it.
866-447-3344. It's a pop up on your phone, Marcel.
It did on both phones. Hey, Bettina, DJ B-Lo.
Secure home and automation. You've heard the name. Now experience the promise of ultimate safety that they bring to your home. Call Stacy Chauncey at 866-447-3344. Stacy Chauncey, 866-447-3344. Are you looking for funding to start or grow your business? The Dream Center has taken the time and done the research to compile a list of over 700 grants for business owners. Yep, you heard right. Grants, free money for business owners to start or grow their business. No matter your needs or size of business, you'll receive the dedicated support you need. Take advantage of
10
grants and
seconds.
free money for your business. Just go to www.thedreamcenter.com to get your copy of the list today. That's www.thedreamcenter.com. We're in the raw. On the Brunch.
So, on the conversation of how technology has been screwing over black folks, let's take Madeline Michelle Carton for a perfect decades-old example. The Missouri woman had been fighting to prove to the government that she is in fact alive and not dead, thanks to an error by the Social Security Administration. Carton has been explaining her stories to very news outlets, including laying down what the issue is behind the bizarre yet haunting scenario. In 2007, she told reporters at KSDK that she realized her financial aid application to Webster University had been denied. On her paperwork, she was classified as deceased. That meant she had to prove to the school she wasn't actually dead or part of some crazy scam. It didn't take long after that for everything else tied to her identity to suddenly become null and void. More from 5 on your side. She couldn't graduate, and nearly 2 decades later, nothing has gotten easier. 20 years. And I quote, "It messed up my whole life," Carton said. "It's impacted my life financially. If I want to buy a house, that won't happen." She says she can't get a mortgage, and even keeping a job is nearly impossible. It's just a matter before my Social Security number catches up with me, and then they have to let me go. HR can't process payroll, she said. The death master file. Turns out Carton isn't the only one facing this problem. In a 2019 report released by the Social Security Advisory Board, the agency found that between 7,000 and 12,000 people are wrongfully recorded as dead by the Social Security Administration annually. Though the number of reports is generally decreased, not deceased over time, the board wrote, that doesn't help cases like Carton, who is still trying to get back on grid nearly 2 decades later. She received little to no help after seeking the executive branch and various government officials, per People's Report. She filed a lawsuit the same year the SSAB report came out. However, it was dismissed due to the government's sovereign immunity. The government cannot be sued without its consent. By 2021, she decided to change her name from the original Madeline Coburn and was able to obtain a new Social Security number, but even more sloppy mistakes got in the way of that too. She told People magazine her name is spelled incorrectly on the court order and her SSN number is incorrect on an online hub for employee verification. She also can't sign off on her son's FAFSA papers or vote in any election. There's still no answer as to how the SSA decided she was dead, according to the agency's report. It could be as easy as a spouse or neighbor reporting her death to the SSA, yet there's no clear solution to how the problem can be fixed, despite her exhausting every resource. And I quote, "I just know I'm alive. I don't care what the AI says or software says, but I'm alive. But it's hard to prove that," she told NBC News last month. That is very interesting. She has been dead on paper for 20 years. I wonder, could she get a life insurance policy? The questions we have. Well, the government, I would think this would be an easy fix. You go in, show them your face, your birth certificate, your ID, and show them that you're alive. But I guess our government is a little too complex for them. But we're going to continue to pray. Well, it's not like she died. I was about to say pray for her. Well, we're going to pray that she continues to live and that the government finally corrects her. But you know what? She needs what the song is about to say. She needs a miracle right here on the Brunch Bunch. Hello. How you doing? Paris Thomas?
Yeah.
Dr. Paris Thomas. Your friend is not feeling good, DJ B-Lo. That airdrop failed, Zoe.
Oh.
Hey.
Probably put you on live. I took it.
Okay.
Hit on Saturday. It's still talking about you guys. Talk about they gonna volunteer.
Hey, Miss Jackie, how you doing?
Do you guys know each other?
I do.
I can just get to see you.
You have a minute for a hook.
Yes.
She said I had a minute for a hug. Thank you so much. What's your name? Hi, Justice.
Hey, long time no see. How you been doing?
Good, good. I think yes, I am.
This is your zoo weekend.
Yes. I'm trying to send an email out as we speak. So I know you got two guests, and we're gonna come in a little early. So after this, drop the win-win intro. How was the play?
It was good.
Okay.
Because I'm fat and I like to be the first.
I need about 30 seconds.
So yeah, she always give me the best seats.
So
Well, you know,
I need about 30 seconds. You need 30 seconds. We got commercials.
they just emailed me about I don't even remember the rapper name.
You
Some rapper, the old school rapper. He in a new Broadway play.
I didn't know what a ladies' man he was because they told it through the view of his four wives.
The hip hop nutcracker.
Yes.
So we did the branding. I'm sorry to interrupt you. We did the branding for Illinois Breast Cancer Task Force to change the name to Equal Hope. I worked with David Ansel I worked with David Ansel 20 years ago at Cook County Hospital.
So guess what? So I'm one of the founders with David.
I remember.
We were just like, oh my goodness, you're gonna have fun today.
Good synergy.
It is.
And Aisha kind of knows what I remember. It's getting better.
Every Saturday at 6 p.m. Central Time to the Word Network, where Corby Bush Ministry brings you powerful messages that will touch your heart and transform your life.
Yeah, because you're being seen.
You're right.
And heard.
Call 214-371-8766.
Jackie, how long have you been there now? 2 years?
4.5.
I remember when Jacqueline was like,
2019.
oh, you weren't right in the pandemic.
It was right before the pandemic.
Because Jack Lynch was more excited than you. You know Jackie Bishop. You know Jackie Bishop. You know Jackie is over there.
That's because I've known, as you know, I've known Jack for a minute. Yes.
I'm Jack. Okay. Okay.
It's hard to
A secure home and automation, they understand what it is to protect these homes. As a Bricks authorized dealer, they stand guard over 1 million homes and businesses, ensuring safety.
Is she back from London?
No, she get back today.
Okay. And now it looks like I'm going to Springfield Monday, Tuesday. I'm like, why y'all gonna do that to me before I go to Arizona
Oh wow! Cause when you leave for Arizona,
Wednesday?
the retreat.
Oh, you guys have to know about I Am That Woman retreat that Twyla Jenkins does. There's a health component to it. It's healing. It's money.
I think my god sister is part of that. Do you know Ella Brickman? Ella was her name. She worked with advertising.
So go
So
ahead
she
and call
probably is.
447
She had like a little phone
That's
for it, and when she's Sedona, is it?
Yep.
That's it. About some
secure your tomorrow.
Gotta
Secure
buy some
home
of the
and
popcorn.
automation. What's the name?
I just give donations because I was
No,
eating.
I gave a donation. I need popcorn.
447-3344.
Could you be quiet?
866-447-3344. Your health is indeed your wealth, but your mental health is your true fortune. Soulful Chicago is a mental health book lounge, a place of peace that assists you in finding your center. Not feeling therapist? No problem. Afraid to take mental medication? No problem. We have an array of holistic alternative methods to make your mental work for and not against you. Call Soulful Chicago 312-291-9678 or stop by to speak with one of our specialists. Let us design a rescue package just for you. Our emotional intelligence book and our healing cafe is as relaxing as it is inspiring. We feed your soul and your body, so stop by 1508 West 18th Street today or call 312-291-9678. That's 312-291-9678. Become a member and start your healing journey. Come in empty, leave out full. Soulful. Follow us on IG and Facebook at Soulful Chicago. It's time for Community Chatter with Winona Redmond, sponsored by Win-Win Communications.
Well, of course, every Tuesday is my favorite day of the week because it is community chatter with none other than the queen of shining the light. And that's Winona Redmond. Every week she brings me a new best friend. Today she brought me two, and I happen to know one already. So I'm so excited. Welcome back, Winona.
I'm happy to be here, Marcel. Always happy to be with you. And thank you for the flattery. I know every day is your favorite day. But and I know that you have a lot going on. We know Tamara is the world traveler, but
Yes.
as you know, we say my dad Bobby loves Hidden Figures. I mean, he watches that show at least once a month. But with Community Chatter, if you shine a light, then it's not hidden. And there's so many wonderful things in the community, and I'm really excited about
Yes.
today. You know, win-win community 11, if the Lord says the same, November 20th. And we made a commitment that we're working with causes and people we believe in. And healthcare is more than 50% of our business. So we have two guests today. I'm just excited. We've got Dr. Paris Thomas, the executive director of Equal Hope. And we've got Jacqueline Burgess Bishop, who is the CEO of the National Kidney Foundation of Illinois. And I've known both of them, and there's an intersection. You know, every month you have multiple health causes. This month is breast cancer. It is domestic violence. So it's pink and purple. But last month was kidney. I mean, there are multiple health months for organ donation. And kidneys official month
It's March.
it's March, but you have your annual Life Gala this Saturday,
Yes.
and we know the kidney color is orange. So I'm like, I'm not even trying to be color coordinated today because I can wear purple, I can wear pink, I can wear orange. But welcome, ladies. We're gonna start and jump right in with all this going on with breast cancer, and there's an intersection. Equal Hope. One of my heroes in healthcare is Dr. David Ansel, who's published books on equity, and you know he is someone I worked with at Cook County Hospital 20 years ago with Ruth Rothstein. And honestly, Cook County Hospital is the training ground for some of the best giants in healthcare all across the there. I was the baby on the management team with Dr. David Ansel. There was Gordy Schiff. There were all Marge Cohen. All of these people that are all over Chicago that started at County Hospital. And so when Dr. Ansel, of course, moved around to different places, and when he ended up at Rush, he mentioned, "I'm getting ready to do this Illinois Breast Cancer Task Force." And he asked, I was able to be part of rebranding Illinois Breast Cancer Task Force to Equal Hope. And Jackie, I know you had a role with that. And so I don't know if you want to share that before we bring Miss Dr. Paris Thomas on. And because you've had a very busy month for breast cancer, but I love the fact that Equal Hope said we're going to work on this, but we believe we can eliminate some stuff. So welcome,
Welcome. Woo, woo,
welcome.
woo, woo.
But since you were one of the founders with Dr. Ansel, Jackie, want to introduce yourself and your role with Equal Hope, and then we're gonna come back to the kidney. We're doing this chronologically.
Okay. All right. So honored to be one of the founders. I was on the board in starting, at that point, the Metropolitan Chicago Breast Cancer Task Force that really arose from earlier work from the Sinai Health Institute.
Mhm.
Then there was really a phenomenal gathering, in terms of symposium held at Rush, from which point the issues were so critical. Definitely, the inequities were so obvious, and
Mm.
a group said we need to move forward with an organization to change this trajectory. And at that point in my career, I was with the American Cancer Society, and I attended, and then Dr. Ansel and many others, so many others, Dr. Linda Murray.
Yes, Dr.
And I can
Murray.
just go through the list, of individuals that, of course, Dr. Whitman, we miss him tremendously. So others um, really developed work groups. The work groups met, you know, addressed issues such as access to care, access to treatment, and quality of treatment. So
Mm.
with that, I would say the Metropolitan Chicago Breast Cancer Organization was born and has done some absolute phenomenal work through the years. And I departed the board a little while ago. Always been a supporter,
Mm.
and in fact had the wonderful opportunity. This is another segue. A wonderful opportunity to meet Dr. Paris at their latest gala earlier this year.
Wow.
And that was how many years ago when the Metropolitan, because
15.
15 years ago.
Thank you, because I was like 7, 8, and 6. Thank you.
And what's great, I'm happy that Real Times Media, Diana Lewis, and that I'm working on the next edition of Who's Who in Black Chicago, because when you look at Chicago, we run the world. When you look at what goes
Yep.
on here, the pioneers in healthcare are here in Chicago. Dr. Renslow Shearer was at County Hospital.
Right.
We celebrated the first 20 years in HIV/AIDS at County Hospital. So when you look at the wonderful health collaboratives that we
Yes.
have right now with all the hospitals and centers working together, it just speaks to the fact that Chicago is a training ground, but it's a pioneer in healthcare.
Absolutely, and it even branches out into the community because, ironically, I met Dr. Ansel. We served on an HIV board
Mm.
together.
But Dr. Paris, welcome.
Welcome,
And
welcome.
I know you have a PhD in health and human services from Northern Illinois University, and that health equity has been one of your career paths. And I was fortunate enough to have the late Ruth Rothstein as a mentor. And she worked her way up from admissions to the president of Mount Sinai Hospital before taking me with her from Sinai to Cook County Hospital. Then before it became Stroger. But she always said healthcare is a right, not a privilege. And way before we got into health equity, way before we got into disparities. But come in your own way. Tell us what you do. And my sister, you just did Greater Rocks breast cancer luncheon this past Saturday at the Golden Dome, and my sister Rochelle Simpson, she's a VP in HR. She doesn't get easily impressed, but she was just raving about, I don't have time, but I need to volunteer. She was passionate. She was, everyone said you were on point. So tell us about breast cancer month, but tell us about your work, because it's not just breast cancer, it's everything.
Absolutely. So, as was previously said, we've been around for 15 years. Equal Hope has been a conduit that's been, kind of a pillar to say that structural racism here in Chicago does exist. We have a very unique healthcare system here in Chicago, and we were able to compare that to other cities. And when you looked at breast cancer, originally Black women were dying at a 62% higher mortality rate than white women, which was the original problem that we saw here. But when you looked at cities like New York and Philadelphia and San Francisco, there was almost no disparity between white and Black women. We know genetically white and Black women's breasts are no different, but there's actual structural components here in Chicago that play a part in the disparity. And that comes back to what Jacqueline was speaking about, the access to care, the actual quality of care. Here in Chicago, we have safety net facilities, and we have amazing safety net facilities that are here to serve our individuals of color and who are in underserved communities. But unfortunately, those hospitals aren't poured the same resources as some of our bigger academic institutions. But where's the community accessing care, which is the really key component, and where does the community feel safe when they're accessing care is a key component. It's in those safety net facilities. And so it's about reinvesting, which our community organization has spent probably the last 15 years really investing in that, in a model where we not only pour resources like nurse navigators into those facilities, but then also working on the component of advocacy. What actual policies can we put in place to move a needle? Because we can do interventions all day, we can put somebody in place, but that's just a band-aid to a bigger issue. And so we can actually address those issues through policy. And then we also look at research. We never attacked anywhere intervention-wise, and I'm sure you know this, Jacqueline, without data. We have to understand where the disparities are in our communities, and we know in certain Black communities that the lifespan for Black people was only at 64 years old, which is a problem. We should have the same right. Like you said, it's a right to live. It shouldn't be a privilege. It's a right. And that's really important in the work that we're doing every day through Equal Hope.
It's exciting with the work that you do, but advocacy is so critical. As we work with the healthcare collaboratives, we are fortunate to have policymakers that really care. Senator Maddie Hunter and Rep. Camilla Lilly, they were really leading the pillar when the Illinois Black Caucus made some groundbreaking policy changes, and they came out with those 4 pillars that looked at everything. But when you look at our policymakers and how hard they work, Donald Dew at Habilitated Assistance Inc., I'm like, you almost are, he's a servant, but he helps to advance those policies and advocacy. But so when you speak to that access, years ago, everybody could find a free mammogram, and now more and more services are being cut. And so my sister was like, we're really looking for access to free mammograms. Equal Hope is one of the last programs that really is still not only advocating, but still providing that access for those who need free mammograms, correct?
Yeah, correct. There's several organizations, including Equal Hope, that do this work. And on top, there's a statewide program called the Illinois Breast and Cervical Cancer Program, which can actually serve anyone who's uninsured or underinsured and give them access to that. And you can not only access that through Equal Hope, but there's several federally qualified health centers like Chicago Family who are involved in that project and have the ability to navigate people to care. Not only that, Equal Hope also specializes in things like cervical cancer. So it's really important when we get women our clinical breast exams or our mammograms that we're pairing it with our gynecological issues, because we know that that's a problem as well. Women shouldn't still be dying from cervical cancer, but we still see that today, which is a big issue. So that's some of the programs that are out there that can actually provide that free services. If anyone's interested, you can always go to the Illinois Breast and Cervical Cancer Program website or equalhope.org, and we're able to help you navigate to those free resources.
Okay, so we're going to make sure we post that, equalhope.org, and all of the other services. So with the rebranding of Equal Hope, I know that there was the belief that cervical cancer, and looking at how other third world countries were doing, that this actually had hope to actually have a solution ahead of everything else. So with all the services that you provide, you're saying the cervical cancer, And I see your research. I see your data.
So yeah, cervical cancer is definitely the one cancer that we can actually prevent. We know in Rwanda that they've actually eradicated cervical cancer based
Wow.
on policies. HPV, which is a vaccine, and I know our community is a little stigmatized when it comes to vaccines, but it can prevent cancer. We're still seeing women, especially Black women, showing up with advanced cancers in hospitals and dying from cervical cancer, and it's preventable. You can get the vaccine. They've even increased the age of vaccines, and I believe it's up to the age of, I think, in the 30s now, that women can get vaccinated with the HPV vaccine. Before, it was a vaccine that was targeted towards younger kids, and I know some parents have stigma around, do I get my kid vaccinated? We have a lot of conversations around HPV. Like, if I introduce HPV, is this introducing like sex to my kids? It's not. It's really a preventative measure so that later on your kids don't have things like cervical cancer. But HPV is also stopping other cancers, such as throat cancer is on the rise. We're seeing other cancers, anal cancers. Though all those cancers have to do with HPV, and it's important to get our kids vaccinated so that they no longer have to die from these other cancers that can be prevented.
Wow.
That's something else, Marcel. I know you biting at, chomping at the bit, but before I
I'm writing my questions. I'm waiting. It's good info.
before I transition to Jackie, kidney cancer and cancer. Period. My sister is a Sunday school teacher. She was like, "Cancer's from the pit of hell." But my mom, just died of kidney cancer. Ultimately, it was kidney cancer, but it traveled, metastasized tumors traveled to the brain, and she had a stroke. But there, we worked at fundraising for all different cancers. And I know one guy said, "Oh, prostate cancer, we're gonna find a cure quicker than that." But everyone's saying, "Why haven't we found a cure for cancer?" But you have the perspective, Jackie, of American Cancer Society as well as kidney cancer. So tell us what's going on in your view of cancer and your services. And I can't believe it's been 4 years that you have been CEO, but you've got how many years in cancer?
Well, in healthcare over 30, and then when I focused in on cancer, it was solely, it was at least 7.5 years, but over at this point years that that Paris is talking about. As we know, there's over 100 different cancers, and when you in terms of,
I didn't realize it was 100. I knew
Yeah.
there was a lot.
over,
There are over.
yes.
So
And I think that that's why some of the key initiatives like the moonshot is popular, but needs to be stated in terms of that self empowerment and how to. And this goes for multiple chronic conditions, but how do we empower ourselves to make a change, and then leveraging social determinants of health that we know exist, as barriers to nutrition, for example, to housing, etc., to move it forward, so that people have access, for healthy eating, healthy nutrition, safe environments for exercise, and the factors that contribute to the reduction of multiple chronic conditions, including cancers as well as kidney disease. And in the case of kidney disease, it is the primary risk factors deal with diabetes, uncontrolled diabetes, and uncontrolled hypertension. And so getting our arms around that. And because in the case of kidney disease, we're considered quote unquote like a downstream disease because it's more asymptomatic. You don't get the symptoms that you may get with other chronic diseases, and people also are not aware that there's 5 stages of kidney disease. And you hear about the term people quote unquote crash into dialysis because they did not know. So what we strive to do is educate primary care providers when is it a good get people tested. And that's the major message that we have. Just like for breast cancer is get the mammogram, get it annual. And if you're in a in a high risk category, you may start younger with your mammograms. And for kidneys it is get tested. And so there's 2 tests that we call the kidney profile that we work to educate our population, all populations. And by the way, we know Kidney disease is a health equity issue. Blacks are nearly 4 times as likely to get kidney disease. Latina Hispanic populations 1.3 times as likely to get kidney disease. And I think a number of us have seen the Orange Kidney Mobile traveling
Yeah.
throughout the state of Illinois. And our purpose, what we do, point of care testing, so that we can actually stage let you know what stage you are in. And so there's 5 stages, four, and definitely five is failure. So what we try to do, and we have had people walking with blood pressures over 200, 250,
Wow.
and they come in and they get screened, and we. In those cases, direct them, to emergency services. But and what we also do as a result of screening, we have professionals, health and medical professionals that help the our individuals that go through the screening and interpret the results. Because what good is it to give you a sheet of paper with this point of care testing results and you don't know what it really means? And they guide through, and we also have additional information on nutrition. And what we look at is meeting people where they are. So we have develop different programs. We partner. You may have heard of Black Care, for example, and that is an initiative we have that's funded through Baxter. And it's the links incorporated are the civic and community-based partners that reach out into the community to educate. One of our biggest challenges in the kidney sphere is the lack of awareness. The lack of
Mm-hmm.
awareness of, and really we get a little technical, every 30 minutes, your kidneys are filtering the blood throughout your body. So we take them for granted until they're not working.
How do you so like when we do our annual physicals, the kidney I mean, I know they test urine and test blood, but
Right.
how do you get the screenings more included in these screenings?
Great question. And particularly if you're in the at-risk category, diabetes, hypertension, have obesity, a family history. For example, African American, Latinos. Some of the risk categories. Uh, Asking your doctor is 2 tests. I call it the kidney profile. One is a blood test, and it looks at um, basically it tests you for your EGFR, and that's a rating that is used to tell the degree of your kidney function. That relates to those 5 stages. The second one is a urine test. The EGFR test, the serum test, the blood test is usually included in one of your profiles that your primary care physicians order. One big aspect, and you talk about advocacy and the impact, was that, as a result of the National Kidney Foundation and the American Society for Nephrology had changed it took out, there was a race coefficient in that calculation.
Really?
Wow.
Yes, that impacted Black people. That has now come out, and one of our missions is to make sure doctors are aware, laboratories are aware, and what it resulted in is people receiving their diagnostic results would indicate they had a higher level of kidney function than they did. So what happened? So medications weren't started, at a point that they usually would be based on algorithms. It also impacts tra- um, the transplant end when you get to that end. So we look at that and look at the disparities throughout the system and work to make those changes.
And we're going to make sure we post on both your organizations.
Yes.
I want to make sure we get
nkfi.org,
NKFI,
www.nkfi.org,
nkfi.org, and
Yes.
equalhope.org. Our time runs out so quick, but I want to make sure we talk about your event this Saturday.
Yes.
And where people, is it sold out? Can people still?
Just about. But if people want to, if they go to the website, it's
nkfi.org.
October 21st, Saturday.
This
It's at the
Saturday.
Hilton, Chicago. And we're going to celebrate. We're going to honor our honorees. Include the Dr. Breva, Wakan Breva, and his wife Jennifer Sutton Breva, and he is on staff at Northwestern Medicine,
Okay.
and he received a kidney transplant. And it's that case of what happens when the doctor is the patient. Is a compelling story.
Yeah.
And our corporate awardees are NANI, which stands for the for the Northern Illinois and Indiana Nephrology Practice Association of Practice. And so and they are one of the largest practices, most dedicated in communities of color, serving everyone. So we're excited, and Joan Colosso is our entertainment.
Oh, wow.
So yeah,
love
so we
them.
want you guys, if anyone, they can go to the website, and we're just about, but they can get to.
Got a
And
few
we got-
seats left.
I know I know that we started talking about the color of orange and the color of purple and the color of pink. But when it comes to race, you just said it. You know, I love for both of you guys to come in. We're working with Westside United. There's something, there's going to be a whole piece on pressure. This whole piece with rampant diabetes, rampant high blood pressure that relate to,
Kidney
this.
disease.
And then when we talk about nutrition, I've worked with Dr. Terry Mason and Dr. Damon Arnold with Rainbow Push for years on all of the panels for health, but there's the advocacy piece, but there's also the self-determination piece. How do we talk about race? We do all of it. We can do all that we can say about equity, inequality. But when I worked in retail grocery and some of our neighborhoods where they're like, you need access to fresh produce, they threw away bushels and carts of produce. In one store, they made half of the produce area a Dollar Tree type area, and it did good business. But how do we speak to race and speak to us? I know diet and nutrition is part of it, but
it's also knowing what to select and how to prepare. So initiatives like the one you talked about with Dr. Mason, like what we offer, we have a dietitian on staff at no charge that will work with the public to give recipes. We have a cookbook, that provides recipes, because part of it is you give some people jicama. They're like, what is that? And how do I prepare that? How do I make what's good to my palate healthy and healthy for me? So
Marcel, I know you have a question. Marcel got 2 babies, and he's battling cancer and all of this with family. We all have been impacted and touched by it. But
it's just some great information. I've been taking notes with texting. I know Miss Jackie is a hard worker, killing the game, but our community. And I saw recently, and I've experienced some of the disparities in the healthcare system overall. And unfortunately, we don't have enough Dr. Paris's and Miss Jacqueline fighting and advocating for us. And so kudos to the work that you both are doing, especially cancer, kidney. It's ironic, in our community, we have a dialysis center, and then they put a bakery in the same building next door to the dialysis center, and it's like, how ironic.
The education on what to select, what is healthy, or what you need, and what can make that difference. You mentioned we go back to advocacy again. So for the Illinois Kidney Disease Prevention and Education Task Force, Dr. Maddie Hunter. I'm sorry. She's a doctor.
She might as well be a doctor, because all the legislation, the senator
Maddie Hunter and Representative Maurice West are the co-chairs of that task force, and it's a legislative task force. That's part of it. It's a 360 engagement. It is philanthropy, it is advocacy, it is the healthcare system, it is us, in terms of empowerment.
And I truly believe Chicago is ahead of the game when you have policymakers. And Dr. Terry Mason, when I talk to him, he always is the refrigerator is the, it was like, that's the new pharmaceutical.
He's right. I saw Dr. Mason at another event. He said, Jackie, we're going farm to table for real.
Yeah, we have to. And you know what? It's so crazy in our communities. And I've been talking to people about this. The doctor will say, take these medicines, and you just trust them. But we say, eat healthy food choices, and you don't trust what's coming from the earth. And I said, our people really got to be educated a little better. So what you guys are doing, It's amazing work. 2 events coming up. Dr. Paris, you have an event?
No, I don't.
No,
have
you
an
don't
event,
have
but
an
just
event.
to add to the conversation, on top of lifestyle factors, there are structural systems still in the play. When we talk about healthy foods, we have to make sure we have access to those healthy foods. We can't say eat healthy and then you don't have access. We can't say go to the gym, but I can't walk around my community. These are structural things that are in place that deter Black people and Hispanic people from actually accessing the care they deserve. And so it's a whole system. It's lifestyle. It's a system. It's economic.
It's partnerships.
Yep, absolutely.
It's partnerships.
I got quiet because this conversation, I didn't want to take over the conversation. When we talk about disparities in healthcare in our communities, you're right. We don't have access. You know, Hot Crunchy Curl is viral now because they brought the original flavor out. I'm like, please don't eat. Look at Rolanda, pray for it. Come on, did they? No, don't go get them Hot Crunchy Curl. Lord Jesus, believers, listen, Winona, you always bring the noise. I learned so much, and I'm grateful for Winona and Win-Win and all of the organizations that she's working with. Ladies, we got to have you back. Shining the light. We're going to do a brunch bunch win-win healthcare panel and bring all of our believers in. Rolanda,
thank you, because what you do, they need to see us and believe us.
Yeah. So believers, guess what? You can believe this. We are out of time, but we are never out of content. We encourage you, like we do each and every day, keep Love 24 alive, but we're going to add something to it. Eat healthy. Choose better options when you're going to the refrigerator, because it will affect your health. And we want to start doing more preventative care versus waiting until we need it. We're going to bring
Dr. Happy back too, because his whole thing is breathing.
Yeah, well, up next is AC Green. After that, Pastor DeAndre Patterson with the afternoon drive. We get it done all night long right here on Inspiration 1390. Yeah, I'm listening to kidneys. We got more dialysis centers in our community than anything. All right, see you, Facebook. Thank you, DJ B-Lo, for texting me that we didn't have no sound. Okay, see you all.